I'm Thomas Lewis Matthew. I am a cardiac surgeon who had cardiac surgery. I began in private practice for 30 years and I joined the Johns Hopkins faculty 6 years ago as their director at Suburban Hospital. What actually happened was I had chest pain and was diagnosed with multivessel coronary artery disease, and I needed cardiac surgery. In fact, when I looked at the films, I said to myself, oh, great case, I wish I could do it. But I instead trusted my partner and my team to do what ended up being a 4-vessel bypass. When I was done, I needed cardiac rehab. I wanted to do it out at the beach. I'm blessed to have a beach house. And when I called all the center-based places, they all said that they were full and they had a waiting list that was 3 months long. And then I remembered ROMTech, a company that I'd come across as a focus group advisor some months before I even knew I would need it.
I see a pulse rate of 75 beats per minute in a normal sinus rhythm, which is great.
And I have been able to do many weeks of cardiac rehab at the beach house, which made it possible for me to stay and recover in the comfort of my own home.
Good, good.
With ROM therapy, home-based cardiac rehab, there are a lot of benefits, but to me, the greatest is that people actually complete it. It doesn't compete with work, and it also doesn't require travel. For those two reasons, people often miss their center-based therapy sessions. There have been several studies that have talked about patient completion rate, and many of them show that the completion rate is less than 20%, some as low as 16% completion for cardiac rehab. With the home-based cardiac rehab ROM therapy system, the completion rate approaches 100%. I absolutely think that ROM therapy is the future of cardiac rehab. There is nothing similar to it. I looked for myself personally and wasn't able to find help. And when I went to ROMTech, they were able to set me up in my own home in a place where there was no center-based available. And because of that, I can see more and more people wanting to have that in their home. And I think we will see several things. One is a decrease in readmission rate to the hospital. Another thing is that patients will be able to return to full activity sooner and will be able to maintain a healthier lifestyle.
I'd like to get you scheduled for your next exercise session within this ROM therapy system.
I have referred patients for ROM therapy. I've benefited from it, and I believe that many patients will benefit from it.